COVID-19 pandemic has been a challenging task, especially in rural areas of developing countries that have historically faced significant shortages of healthcare resources. Compañeros en Salud, which we all know as CES, is a non-for-profit organization affiliated to Partners in Health and has been working over the past 10 years mainly to provide primary healthcare attention in rural communities across Chiapas, the state with the highest number of people living in a condition of poverty and extreme poverty in the country. So in this context, the Infection Prevention and Control Department of CES focused on designing and implementing a strategy with the purpose of supporting risk communication and community engagement in one of these communities. So first of all, we designed a survey based on a Risk Communication and Community Engagement (RCCE) Action Plan Guidance COVID-19 Preparedness and Response Tool, which was provided by WHO. To gain a better understanding of the risk perception of community members, their general views and main communication channels and influences, as well as acquired knowledge and attitudes regarding COVID-19. So this survey was applied to a statistically significant sample of the population with a 95% confidence interval and a 10% margin of error. It was also complemented with 5 individual qualitative interviews that were made to the health personnel or COVID-19 frontline workers of the local clinic to acknowledge their views on how community members perceived and responded to COVID-19 and to the measures being implemented to address it. So with all of this information that we obtained from the community and the health personnel, we developed a comprehensive door-to-door health promotion strategy to transmit specific health-related messages, which included key information and were clear and relevant, as well as culturally appropriate. So the strategy was undertaken in 187 out of the 264 houses of Reforma, the community, which represented 71% of all community households. A final risk perception survey was applied approximately 1 month later, and it found a percentage point increase of 22.45 in the number of people who would attend the health center if they developed symptoms, and an increase of 4.5 in the number of respondents who said people over 60 years of age and people with chronic illnesses are at greater risk of complication for COVID-19, and also an increase of 52.80 in the number of respondents who considered COVID-19 a very dangerous disease. Thank you for listening.